The stigma around mental health exists almost everywhere. We may think this is something very peculiar for Japan. Trust me, it's not. If you had some unresolved issue in your country, you can be fine. But then when everything changes in your life, going to Japan and changing your roots, that lack of that sense of belongingness is the cause of many, many problems for many people, especially those that come from individualistic countries.
Hey there, and thank you for tuning in. We're excited to bring you another great conversation today. If you like the show and want to support us, please hit the subscribe button so we can keep bringing you great content week after week. And if you're feeling extra generous, give this video a like and share your thoughts and comments down below. Thank you so much. And now, let's get into it. Welcome to Unpacking Japan. I'm Toby, and today we are sitting down with Mira Yamashita. You're a psychologist based in Kobe, I believe.
Yes.
And you're originally from Serbia.
Yes.
What brings you to Japan?
Well, to Japan, I came on scholarship as an international student to study psychology. That's what brought me to Japan 22 years ago.
Okay.
Then I found love and stayed in Japan. That's why I stayed so long. So in short, that's it.
Did you have an interest in coming to Japan before, or was it more like a complete accident of seeing the opportunity with the scholarship?
I don't like the word accident, but it was interesting happening, I think. I very coincidentally went to my university for some training, I think. I was already working, so I already graduated and I was working. And, you know, once you graduate, you don't go to university normally, right? It was some occasion that I went for something. And as a habit, I went to see a message board. That's what I was always doing as a university student. And I saw this big, teeny tiny piece of paper somewhere at the bottom, near the bottom of the message board, saying that from this autumn, people who are graduated, like bachelor, have opportunity to apply for a scholarship, Japanese government scholarship, to study a master course in Okayama University. And I saw that and I was like, whatever, that has nothing to do with me, right? Then I spoke with a friend of mine, also a psychologist, and I told her what I saw, and she told me she just got married right before that. She said, if I didn't get married, I would apply. You're not married, you're going to apply. And she literally pushed me to the dean's office, and the dean was very happy to see me because they just made a contract with Okayama University, like exchange, and it was very short deadline. So it was winter vacation when I went. There were no students, nobody to see that. And the deadline was, I think, February. I was there. I had all conditions. He wrote me a recommendation letter. I collected documents. I got my scholarship. It was like, wow, I have never thought of Japan really before that.
Did you have any expectations then? Like, suddenly you realize, I'm going to Japan, I'm going to Okayama, and started thinking about what is it going to be?
Well, yes, once something like that happened to you out of nowhere, of course, it's very exciting. I felt very safe to go to Japan because Japan is known as a safe country. You know, everything was paid, something like that never happened to me, you know, given that I'm from a country where we had 2 wars and all, you know, difficult things. Having something so lucky was unexpected. It was very exciting. Of course, I didn't have to think twice. Then off I went.
You were already working at the time and you had studied psychology.
Yes.
Psychology is a field, I feel, that is also very cultural in a way, where if you study it in connection to your home country or something like that, it may translate more difficultly. That is not an English word, but I will use it anyway. When you go to another country, especially when you go halfway across the world to Japan, where maybe the understanding of psychology and how it works is very, very different. What was it for you then when you had your knowledge and your experience in psychology that you studied back home and suddenly you continue your studies here in Japan?
Okay, so first thing is culture was not learned much in psychology. In, I think, most of countries back then, some decades ago. Psychology as a science is very Western science. It originates from Germany, from Austria, and then developed in America. So by itself, it's very Western oriented. And that's the psychology that I studied. And interestingly, that's the psychology that you studied at Okayama University as well.
Oh.
So in that sense, it was not that much different in terms of that basic content. Cross-cultural psychology involving culture is a relatively new thing in psychology. Most earlier research was always done on Caucasians, preferably men, middle-aged or younger. And then those findings were generalized, and that's how I studied psychology, and that's how they studied at Okayama University as well. But then culture became important, and then that cross-cultural psychology maybe started developing just a few decades ago. So you pick up on the way. Yeah.
You said you felt very safe moving to Japan, also coming from a country, as you mentioned, that has had multiple very tragic wars.
Yes.
What was it when you started your studies? Was everything in English? Was it kind of a continuation, or everything suddenly switched to Japanese?
It was hard. It was really hard. I came to Japan as I was already graduated, so I was a psychologist. I was working. I had some, income. I was adult. And then I came to Japan where I was illiterate, where I was completely dependent, where I really didn't know how, where, when to, organize my life. As international students, we are really taken care of really well. We lived in a dormitory that was only for international students. We had some special guidance only in English only for us. We had some volunteers who were helping us, but really like kids, when kids go to some excursion, that's how I felt. Classes, while I was in Belgrade applying for the scholarship, I was told that they will be in English, but it was different once I came. Classes were all in Japanese, and I didn't know anything. So that part was really hard. First 6 months coming to Japan, I went to Japanese English school. So I was learning for 6 months, but 6 months of learning Japanese is really not enough for university studies. But you have a little special treatment if you come with scholarship, so you can do things in English, you can do things bilingually, you can find a way around. Yeah, so...
You mentioned that the material being studied is the same as you were studying back home. So I would say that maybe Freud or Carl Jung or kind of these writers are also being discussed here. When you started studying and seeing how they're being discussed in Japan, did you notice any difference in how the research was understood or interpreted here?
So what I studied in Serbia was very wide, very basic psychology, including Freud, when I came to Japan. So now it's not, basic education. It's not undergraduate. Now it's graduate studies. So it's supposed to be a little bit more narrow. They didn't have cathedra or department for clinical psychology. So what I studied was something like social psychology, social cognition, and learning was very different because you don't have a textbook, you don't have exams, you don't have practical experiences like what you would expect on graduate studies. It was more like reading articles, summarizing articles, discussing articles. We didn't have exam. I had only entrance exam, but other than that, you just prepare presentations. So I was not particularly not happy, but I was not impressed with education, how is happening in Japan. I was expecting much higher level, but it was not as deep, not as practical. But I did have an opportunity in the meantime to go to America to study behavioral analysis for one summer. So I got introduction from my then supervisor in Japan to go to that summer course. That was really amazing. That was so practical. That was very American, very effective, very
hands-on.
Yeah, so very different.
And yet you decided to continue and you went all the way to a PhD at Okayama University. Did you have some goal in mind with this of becoming a researcher, or were you intent on going back to becoming a psychologist, a therapist?
At that point, when I was at my graduate studies, I didn't really think I can be a therapist in Japan. First of all, my training was all in Serbian, and I thought I can do that only in Serbian language. And when I came to Japan, that was not the thing then, but I was still doing over Skype, like online counseling and therapy with some Serbian expats, Bosnian expats living in America, living in Europe. So I was doing that. But in Japan, I thought, no way I can do this. But, limiting beliefs, we all have them.
Mm-hmm.
So my work at the university was mainly about research. So I was researching about, as a foreigner in Japan, it's very convenient to research about foreigners in Japan, right? So then I learned a lot about cross-cultural psychology, about how that distinction between East and West, and how mental health is understood, and how emotional expression is different, and all of those kind of things. So that was very interesting. And although it was not a clinical learning at that point, it enriched my understanding of people from different cultural background, and how that having that sensitivity and maybe how to call it, like humility, accepting you don't know. Mm-hmm. You don't know everything about every culture, and you will never do so. Accepting that and not forcing any particular protocol.
That research helped you to kind of get into this cultural psychology and get a better understanding of how it's being discussed, or mental health is being discussed in the East versus the West, or specifically in Japan. What were some of the first things where you thought like, this is interesting, this is different from what I learned or what I was discussing back home?
So I think this is now like everybody talks about it, or maybe not everybody, maybe only we in psychology, this concept individualism, collectivism. I think most of us foreigners are aware of it. And psychology, I learned, and all psychology and all therapy, by the way, is very individualistic. It always has one person in the center. And that has good point and not so good point, right? And that's what I studied. And when I came to Japan, then I learned about collectivism and importance of group harmony, importance of gaman, importance of meiwaku kakenai, all of those things that do not happen in Serbia, by the way. So that was really interesting. And also, through experience, Serbia is more collectivistic country than individualistic, although the psychology we learn there is individualistic. So those differences, different kinds of collectivism, comparing that was quite enlightening. Yeah.
In Japan, especially when reading the news or discussing it broadly, there's a lot of stigma around mental health and how it's being discussed. It's perhaps changing a little bit, and we can get into that in a moment. But you mentioned the importance here of the collectivist aspect and to be patient, to kind of take upon yourself, to not create trouble for others. Would you say this was one of the key things also why maybe people are not discussing it more, that they shouldn't?
So, for example, stigma around mental health exists almost everywhere. So we may think this is something very peculiar for Japan. Trust me, it's not. But things are changing because mental health is eroding worldwide, including in Japan. So maybe in the past, mental health issues were considered very private, not to discuss in public, not to disturb anybody. But given that Japan is collectivistic culture, they might have that support within their groups. Okay. So it is very important in Japan to adjust to others, and that's not necessarily a bad thing. When you adjust to others, then you have safety, you have community, you have that sense of belongingness. That that lack of that sense is the cause of many problems for many people, especially those that come from individualistic countries.
The lack of belonging?
Yes, that loneliness and sense that they don't belong anywhere. And that is like a universal human thing. So we talk a lot about mental health being stigmatized in Japan, and that probably is the case. I read some statistics that in Japan, only 6% of population ever had experienced counseling or therapy, while in like Western Europe, I think that number is 52%.
Okay.
So that's a huge difference.
But also probably a relatively recent change in Europe.
I can't say that. How old is the research? I don't know, really. But that's quite striking number. Wherever it happened, it's quite striking, right, for a comparison. I think things are changing. Yeah.
So for you, at the time you do this research, you discover these differences, and you also discover that there's an opportunity for you to be a therapist in Japan.
Yes.
So you graduate, you have your PhD. How did you go on about to kind of establishing yourself here in Japan?
Yeah, so you don't really learn therapy on university, and that's not just in Okayama University, that's a general thing. You at the university, you get, let's say, permission to study therapy. That's how it was in Serbia. You cannot go and study therapy. It's usually like private and outside of university. But in Serbia, we were not allowed to take the training unless you graduate. Now things are changing, and anybody can have such training. In the past, while I still lived in Serbia, I have trained in cognitive behavioral therapy and some like basic counseling, and I was doing that. And I was not, let's say, particularly happy how that goes, because it may take really long time for people to get better, to notice changes, and this therapy session is structured to like allow clients to talk about the same things over and over and over and over. And that doesn't help. It takes a long time to see behavioral changes. So I was doing that kind of therapy for some years, and then I kind of slowly wean myself out of it, thinking, okay, now I have children, I have this university research, I have lots of things to do anyway. But that was my dream, that's why I became psychologist, because I really wanted to be a therapist. And then I have discovered this rapid transformational therapy. I was very attracted to it because, first, it's hypnosis. It's something that interests me always, but was not available to study in the past. Second, because it promises such a big changes, transformation in people in a very short period of time. And that's what really interests me, how you can help a person so they don't struggle for years, but they can change, not in a second, but they can change some beliefs or they can get some understanding in very, very short period of time. That was fascinating for me. So then I studied that for about half a year online. Then I went to Vancouver for a training, final that in-person training. I mean, training is always ongoing. That never stops really, but that initial. And then after that, then I started, and because the training was in English, yes, of course I can do it in English, right? Then I started having clients from all over the world because online therapy was, that was 2019. So before Corona, right? Online therapy was existent, obviously. So yeah, that's how I started.
You shared a lot of interesting information there. I have like a lot of questions coming up, but I want to first bounce off this rapid transformational therapy, RTT, that you kind of now specialize in. You said it's kind of hypnosis. Can you explain more exactly what kind of therapy is it? I imagine there's many, many kinds out there.
Yes, there are many kinds of therapies. But once you start learning them, eventually you figure out it's the same concepts that are just maybe called differently or that may be applied in a little different context. But it's not that many varieties as it may look like. Hypnosis is a very natural state of mind. So it's nothing really so unusual, so spectacular. So how maybe it can be shown in some movies.
Where you have the little thing dangling in front of your eyes.
You can have that. I don't use that. I don't use that. But some people do that, maybe more for like that theatrical impression. Because that point is to distract the client and to make them, to kind of help them focus inward. That's the only thing. So I'm saying it's a very natural, slightly altered state of consciousness. You know how when you drink alcohol, that's a slightly altered state of consciousness. When you sleep, it's also altered state of consciousness. So what happened in hypnosis is that your brain waves kind of slow down a little bit. So now as we speak, or, as you learn something, as you, maybe solve some problem, your brain produces mainly beta waves that are short and spiky and fast. But as you relax, as you maybe watch a movie or as you relax in a bathtub, it slows down and starts producing alpha brain waves. So alpha brainwave state is a state that children have until age of 6 or 7, almost all the time. That is the state that is absolutely the best for learning. With schooling, kids kind of, you need to develop that in order to function.
Grows and suddenly their waves change.
Exactly, through schooling, through socialization, and all of those things that changes. And we need, obviously, those, but we need alpha as well. If you notice, for example, how you feel right before you fall asleep.
Yeah, you feel like you're falling a little bit.
Exactly. Or right after you wake up. So you are awake, you are conscious, but it's slightly different. So alpha brainwave state dominates those. That's the state that we need for a therapy session.
Okay.
And I will explain why. In that state is believed that, we call that sleep of the nervous system. This smart prefrontal cortex that always controls, your decisions, how you behave and everything, kind of goes to sleep temporarily, okay? And what's left is what we call subconscious mind that is always open, always awake, always taking care of yourself. That is the state when it's easier to kind of reach some unprocessed emotions or some old memories that we kind of pushed down or didn't process when we should process them. So that's the state. So there is nothing really, let's say, spectacular about the state itself. That is hypnosis. There's nothing scary about it. Nobody can do anything to you that you don't want. You are aware of everything. You speak. I can ask you questions. You respond. it is just a state of very, very deep focus inward.
In a kind of meditation.
Exactly. Very, very similar to meditation, except when you meditate, you kind of try to keep your mind focused on something irrelevant. But here you have to focus inward. You can feel your feelings more intensely, which is great for us therapists, because when you can unlock the feeling, you can kind of process it and let go of it, so you don't carry it longer than you should.
So it's more like a kind of a media movie portrayal of hypnosis that has given it this image of like, okay, you can get the person to sleep, the eyes have like these spinning circles, and then you get the person to do something that you want them to do.
Yes, that never happens. Never.
How common is hypnosis here in Japan?
I've seen people doing it. Maybe not RTT precisely, but some different kind of hypnosis people are doing it. Yeah, it is considered in most countries is considered as an alternative therapy or complementary therapy. So it's not mainstream, unfortunately, at least not yet. But it exists in Japan as well.
So back to when you establish yourself, you want to kind of bring this type of therapy to Japan and establish and provide it to people. Yeah. How does it work in terms of like licenses and so on? If you want to work as a therapist in Japan, do you need a specific license? Because it's kind of related to something medical, but you're also not prescribing medicine, I believe. That is the role of the psychiatrist. Or at least that is the case in France. I don't know. But
yeah. That's the case in America and in many countries. And in Japan as well, you have to go to psychiatrist if you need a medication. So for psychologists, for therapists is different. Japan has let's say, a not very well regulated that mental health care. So there's a primary mental health care that includes usually going to a psychiatrist, which is a medical doctor. So that's different. And that is under the health insurance. As for psychologists, there is no licensing in terms like how a license is in America. Like you get license, country issues the license. And you can, for example, practice only in, let's say, I don't know, Massachusetts. That's how it goes. In Japan is different. There is no, how to distinct that. You know, you have menkyo and you have shikaku.
Yes.
There is no menkyo for a therapist. There is no menkyo. The only, let's say, shikaku certificate that is issued by the country of Japan is called Ninte Konin Shinrishi, which means public psychologist. And that is relatively recent certification, and it is a requirement only for people who work in some institutions, like in school or in some hospital or something like that. It is only requirement for them. I don't have that. It is not requirement for a private practice, but in Japan, I am certified as a health psychologist. So I have that shikaku, it's called, let me see how it's called in Japanese, Ninte Senmon Kenko Shinrishi. That's me. Yeah, that's what I have.
And then it's up to you to basically offer your services.
Yes.
And for clients, you call them clients, not patients.
Yeah, I call them clients, yes.
To come and seek your help and to do therapy.
Yes.
You said you started working with a lot of the foreign community here in Japan. Do you notice common challenges that they're facing? Is there like a recurring theme in this of people moving to Japan?
Well, loneliness is a big thing. But I cannot say that clients who live in Japan are very different than clients who live in any other country, because people, bring their issues from their countries. And what happens is that if you had some unresolved issue in your country, you can be fine. But then when everything changes in your life, that massive change of going to Japan and changing your roots, and that is very exhausting for a nervous system, then those issues become, exacerbated. Okay. So it's not necessarily that, people may come with all different kind of, we call that presenting issue, whether it's depressive mood, whether it's anxiety, whether it's some physical pains like migraines and whatever, or relationship issues are very common. But once we dive into the session, it's almost always come to something that happened long ago that stayed unresolved. Some emotion that is not processed, maybe in often childhood, not always, but often childhood, something that stayed unprocessed. And then, when something happened to you and then you don't have, let's say, an adult to ask you, how is it? Are you okay? To take care of you. You just swallow that and then you move on. And as you hold on to emotions, then you kind of form some kind of beliefs about yourself. And it is those beliefs and those locked emotions that we are dealing with in a session. It's not necessarily what's going on now, because what you're carrying it wherever you go. Sometimes is environmental problem. If you work in some, toxic environment, obviously that can affect your health. But sometimes depression is the most reasonable way to deal with things. Because if you do work in a toxic environment and then you, for example, do gaman, or you don't respond, or you don't change anything and you just accept it as it is, and you deeply down believe I don't deserve anything else, or when people are stressed, there's this expression, shiaga se makunar, like your, not vision necessarily, but your perception is just so narrow that you don't see that there is anything else. That can be get worse with the current situation. But that was in you before. So then when we resolve that, then eventually you can, see different picture about yourself. You can see what's possible for you. And then you can just, change the attitude you have in particular environment. And that's how change happens.
So processing unresolved issues is a key.
Yeah.
How do you know if it's processed or when it has processed? How do you know you have an unresolved issue if you're not aware that there is this issue?
That's why we need hypnosis. People are sometimes aware, often they're not, because we may take things for granted, and we learn what we live. And some things become normal for us. Intense emotions are nowhere pleasant. In Japan we say it's not socially appropriate to express negative emotions, unpleasant. Nobody wants to see that. So other countries are not like, show your rage. It's not really, especially for a small child. When you're a child, especially, you don't have words, you don't have that power, you don't have that, cognitive understanding of what's going on for you. And you rely on your parents, you rely on your teachers. That's how it should be. But often happens that nobody was there to comfort you, for example, or to reassure you. It happens to everybody. It's not that parents were necessarily bad, or sometimes that's the case, but we just go through life. Many things happen. You cannot process every one of them, right? But those that are intense, they kind of penetrate deeply. And if they are difficult, we don't want to think about them. We don't want to process that. And that kind of stayed forever.
So when these things are unprocessed, or when you are in a toxic work environment, you said depression is a logical response.
Yes.
What exactly, how do you define depression? I feel like it's talked about a lot, but the definition is...
There are many definitions of depression, but you would look at the symptoms. If a person have a very low mood, if they have thoughts about, not necessarily always suicide, but they nothing interests them. They have very low energy. They can't sleep, or if they fall asleep, they cannot get up. Their energy level is very low. They have very negative self-talk. You can hear that as you speak with them, how they explain their symptoms. So I do not diagnose. Okay, I don't diagnose. So obviously I speak with clients. They tell me I have some questionnaires they fill, and then they can share all of their symptoms. But I do not think that diagnosis is always very helpful, because people tend to kind of latch on it, and then that's my identity. And they say my depression, my anxiety, my PTSD, my, and that is very dangerous, because when you call something mine, you own it, and then you start kind of forming your identity around it. I'm depressed. I'm that kind of person. But I think everybody can get depressed. It's like, I've heard some expression that it is like a cold of the mind. Everybody can go through that. Everybody can, there are, how to say, sometimes is lighter, sometimes is heavy and requires longer treatment and requires medication. But depression is not a natural state of mind.
How do you differentiate depression from like just feeling down for the day?
I think definition is like if it lasts for longer than 6 months.
So everyone can get depressed, and I believe the word in Japanese is utsubyo. You mentioned that it's also sometimes talked about a cold of the mind.
Yes.
And just before we started recording, we talked about the wording used in Japanese as well, where the mind is often referred to as the heart. Kokoro no mondai.
Yes.
But in the West, we talk also more like about the brain. The problem is up here, but in Japan, it's been talked about the problem is like here in the center.
I think, I don't think that issue is resolved really, and whether we can, as I said at the beginning, whether we can really pinpoint one organ that is responsible for all of your experiences. As I said, psychology is mainly Western countries. Western culture relies on medicine and technological advancement and science a lot. And it is easier to accept that something is wrong with my brain rather than something is wrong with my soul. So when you think of it as a brain issue, it's kind of easier to accept because it is an organ. We know it's an organ, right? In Japan, it's more, let's say, philosophical rather than like cold scientific. It's more philosophical. And I think in many Eastern countries, when we talk about soul rather than, rather than the brain. So where is your soul? Japanese, they say it's kokoro. Kokoro, kokoro and shinzo, they're not the same thing. Shinzo is an organ, heart. Kokoro is like that soul or mind or emotions, and all of that is in that word. So it may seem a little bit more, how to say, elusive, difficult to understand, difficult to pinpoint. So it's maybe difficult to provide scientific research when you don't know where to look,
When the choice of word is so different and the understanding of these core concepts change, does it affect therapy?
Well, if you ask any psychiatrist, they will always look at the brain. And there's nothing wrong with that, because I think brain shows changes when we feel this way or that way. When you feel depressed, you have different kind of things going on in your brain than when you feel anxious, for example. And that is one way to look at it. But biological side is not the only side. We call it now biopsychosocial. And there are biopsychosocial elements for every issue. Let's not call it necessarily disease. So there are biopsychosocial issues for, kidneys, or for ulcer. Ulcer is known as a psychosomatic disorder, at least in the past. migraine that I often work with is now currently classified as neurological disorder. But throughout history, you can see from, being possessed to being psychosomatic disorder, to being vascular disorder. Now it's finally a neurological disorder. But is it any of that really? Or, we are unnecessarily using that reductionist model to analyze things, but maybe it's just something bigger is going on. And all our systems are connected. You cannot distinct your nervous system from your immune system, from your endocrine system. They just work all together. And then when you have some issue with one of systems, it affects all of them. If you live, let's say, in a stressful environment for a long time, then your nervous system is going to be very tense and very overreactive. And when your nervous system is dysregulated, as we call it, that translates into your endocrine system that then produce a lot of hormones that then affect your immune system, and then immune system kind of slows down, and then you get a disease.
And then the cycle repeats.
Exactly. So what is the cause? What's the older, a chicken or an egg? So they're all connected. So I'm not very fan of that reductionist model that is still predominates, I think, in my field.
You do therapy in different languages. So I also with people from completely different backgrounds. Are you able to do the exact same method with everyone? Or do you, for example, have to approach a session with a Japanese client differently than with an American client?
Okay. So I offer sessions in English and in Serbian. I do not offer only in Japanese, but I have many Japanese clients. And I can speak Japanese, but I don't think my Japanese is that good that I could, or maybe I don't know, with somebody who cannot speak a language other, than Japanese. And Japanese person wouldn't go to a therapist who is a foreign if they don't speak other language, right? My Japanese clients are very fluent in English. They either lived abroad for years, then they came back to Japan. So they see Japan as foreigners who come to Japan, and then like that reverse culture shock, a lot of that. Or they are people who are married to a foreigner. So they are very international in their mindset. Maybe our sessions are like bilingual. There are parts where they want to express themselves in Japanese, but that is also confirmed by research that people prefer to have therapy in English if it's foreign language, because it kind of distances them a little bit. It's easier to explain some things that are heavily emotional. But then when we kind of unlock that, then they can do it in their native language. Sometimes I don't even understand what they're talking about. That's okay when they have to, I don't know, talk to their parent in the session. Sometimes they do it in a native language. I don't know what they're saying, but you see things are happening. They are.
What drew you to rapid transformation therapy is that it is able to kind of show results in a shorter period of time than other therapy methods that may take years. How short are we talking about? If someone comes to see you for help or guidance, what is the timeline for?
Okay, so there's no one clear answer to that. We often say 1 to 3 hypnotherapy sessions. One cycle of RTT is around 30 days.
Okay.
So there are other like follow-up sessions and intake sessions, but main course is RTT session, right? One cycle, okay, so you cannot generalize that because, people can resolve one thing and then something else comes up. But as a rule of thumb, if somebody has an issue longer than 10 years, or they have multiple issues, then I cannot make any promises for one session. I would suggest that they take at least 2 or 3. And sometimes, so that can be like 3 months. But often they like to take breaks between like one cycle, then let me see how it's going now. Then after 2 months, let's have another session. That's okay. It depends. If people are like very in a bad state, then they may prefer to have sessions more frequently. But I never worked with client longer than 3 months, like three sessions, let's say 3 cycles. They may come later for another issue. Or sometimes they just like the experience. Some people just come because they enjoy experience of that emotional expression, of that catharsis. And people love that. Some people, not all people. But maybe I'd say 3 to 6 months.
You're doing a lot of this online too?
I do only online, yeah.
Only online. Is there, I mean, my image of hypnosis is you need to maybe lay down, be comfortable, and you'd be maybe next to me in a chair and guiding me through the process of changing the waves in my brain. How does it work when this is online and you're kind of separated by the screen? Maybe the resolution is not the best, maybe the sound is also, or the connection.
Okay, connection must be good. That's one thing that we have to sort, both I and the client. That has to be good. It happens sometimes that connection drops and it's like, but it's just annoying. It doesn't really affect the session so badly. How it works very well because clients are with their eyes closed most of the time. The only thing that you need to do is, you want to try now?
Sure, we can try.
Just if you can look up as high as you possibly can, like
possible.
you're looking in your eyebrows, okay?
Okay.
Keep your eyeballs like that. Take a few deep breaths in and then out. And keep your eyeballs up. Okay. And now, as you keep your eyeballs up, close your eyelids down, all the way down. That's perfect. And can you feel how it's fluttering in your eyes? I can see it.
I can
We can stop here. We will not go deeper.
Oh, this is, reopening the eyes suddenly is like, okay.
Yeah. So what happens is when you do that and when you keep your eyeballs up and then close your eyelids down, you can feel that fluttering. What happens is that fluttering, rapid eye movement, have you heard of it? Yes.
That's a sleep state, right?
Exactly. Yes, it's a sleep state, but it is that state is called because in that state, I start fluttering like that. Your eyeballs go up and then they start. So this way we can, sorry for putting you on spot. Yeah. It can be a little strained, but only for a few seconds, right? When your eyes start fluttering, then that sends signal to your brain. Now it's time to go to sleep. So it takes only a few seconds. So you do that, and then you close your eyes, and then you can relax your eyes. And I guide you just some simple imaginary, like you are going down the stairs, and there are 10 steps below. And with every step, you go deeper and deeper, and it doesn't take 2 minutes.
Does this work to put yourself to sleep at night as well?
Absolutely.
I'll have to try.
Do you have issue with sleeping?
No.
Okay. I have on my website, you can download like a recording. It's very generic one, but for deep sleep. So you can try and see how it works for you.
Right now I have a little baby in the room, so he's keeping me awake most of the time. But I will try. This is interesting. So
that's the only thing that we do. So I don't need to touch the client. I don't need to make any special sounds or nothing. That's enough for most clients. Yeah.
While doing all this, you're still at the university, I believe. You teach regularly.
Yes.
What exactly are you teaching now?
At Okayama University, I teach, every year I have different subjects, but variety of subjects in psychology. I teach positive psychology. I teach some subject that is called language and psychology. That is more like how language and variety of psychological concepts like emotions and cognitions, how language affect them and in different cultures. So yeah, that's now.
So that's kind of interesting because you said when you came, you were not entirely satisfied of how this was being taught here. Do you now have an opportunity to kind of change, bring different teaching methods, maybe more practice into your courses?
Oh, yes. Yes. I have quite a lot of freedom in how am I doing that. And I have mixed students. Half are Japanese, half are international students. So we do classes in English, sometimes Japanese, but we often compare Japan culture with other students' native culture. And there's lots of, I think, practical work and not that much homework. Sometimes homework, but yeah.
In these comparisons between the cultures, what are the topics that come up regularly where the students are like interested in exchanging on comparing notes or comparing perspectives on?
Maybe, I don't know if they're comparing notes, but topics that come up, emotional expression, for example. We learn a lot about development of emotions, their merging, and then how they become culturally colored as child grows. That's interesting topic. Development, psychological development is very interesting topic, and how culture affects development of a child. Thoughts are very interesting. Language is especially interesting topic because language reflects what's important in culture. And for example, recently we learned there are languages like English, but also Japanese, that have thousands and thousands of words for different kind of emotions, like very specific emotions. But there are cultures that they have only two words. That something like this distinction is like hot and cold. And so there's this debate whether if you don't have a word for a particular emotion, can you really feel that emotion? So that was a really interesting conversation we had in a class recently, and where Japanese students were trying to explain to foreign students the feeling of hakanai. Do you know? It is some feeling that people feel like when sakura is falling down, like how to say that, that life is passing by, and that's some slight melancholy, but it's very, very hard to express it in English. So can you actually feel that if you didn't live in Japan and observe so many sakura falling down? Then you learn feeling, and then you learn the word. So if something is not important in a culture, people wouldn't bother making a word for it. If there are many words for some concept, then you know this is important in this culture.
So that was kind of the conclusion of the debate.
Yeah, it always stays open because there is no one conclusion. And I think in psychology, rarely, if ever, you can say this is a fact. There's a theory, there's a hypothesis, there is a research that provides evidence for that, and then there's another research that provides evidence in contrary, and then there's always a debate. So you just keep learning.
Must be difficult then to kind of navigate, especially in the therapeutic field, if there's evidence for doing things one way and then contrarian evidence all the time, and it's always changing.
And what kind of evidence are you looking for? That's another thing. Yeah.
So as a therapist, then where do you keep your focus?
I keep focus on the client and what they need. What they need, they tell me. So I have to listen. I think that's most of my work, is just to be able to listen, to be supportive, empathetic, non-judgmental. That can be hard part for many. We can be empathetic. That's natural. Judgment is also natural, you know. So that requires, I think, training to stay non-judgmental, to accept anything that comes, because every experience is human experience, and nobody is alone in their experience. That every experience is kind of shared. So just by listening, by tuning in to the client and what they want and what they need, but regardless of from which culture they come, regardless of what are their presenting issues? Deep down, they're always the same things. It's either they feel different, they feel disconnected, different than anybody else, or they feel that they're not enough for whatever reason. Not smart enough, not beautiful enough, not rich enough. And those things are in the core of most people's issues, regardless in which country, which culture, who are their parents, what kind of work they do, what is their education level. When you boil it down, it always goes there.
The human emotions are the same.
Exactly.
Early in our conversation, we talked a little bit about some stigma about mental health in Japan and how it's being talked. Now you've been here for 2 decades and you're also now teaching and seeing the young students approaching it differently. What kind of changes have you seen in the way mental health is being discussed?
I see that people are much more open to it. As I mentioned before, I have 2 teenagers at home. So throughout their schooling, I noticed, there is more and more like pamphlets they're bringing home. There's this counselor, there's that counselor to stop ijime, to a lot of talk about tayose, diversity, about having like understanding about LGBT community, about different kind of mental health issues, about futoko, like refusal to go to school, hikikomori. All of those things are open there. They're out there in the open, and I'm not saying my children are like, yeah, that's happening. So yeah, they don't feel uncomfortable to talk about that. It's just something that's going on, and yeah. So I think youth is being educated better, or they are exposed to more of those things. But on the other side, there is now more need than ever for such education, because mental health in youth, young adults especially, is rapidly going worse and worse and worse. And in the past, research always, when I studied at the university, but I was also teaching that until 10 years ago, that happiness curve, like when people are happiest in their life, that it was like a U curve. Maybe you've heard of that. Young adults are happiest, and then in the middle age, it goes down with what we call middle age crisis, and then it goes up in later age. Now that numbers for young people are horrendous. They are almost same as for middle-aged people. So that is happening globally, not only in Japan. And that's very recent numbers. So it is very concerning. And it is very likely, at least one of the explanation is smartphones, social media, being constantly overloaded with something that we cannot bear, boredom. You don't have time to process any of emotions.
It's too much.
Nothing. Because if emotion comes up, it's so uncomfortable, then let me resolve again to watch
quickly
it.
Go to the
exactly.
smartphone and drown yourself into something else.
Yes, exactly. And interesting thing, I think I want people to know that emotions are very primitive system, and that they have a role in our life to keep us alive, to tell us that something important is happening for us in outside world or inside world. And because they're unpleasant, especially those, unfortunately, they're called negative emotions. I don't think they're negative. They're unpleasant. They're necessary, and they're more important for our survival than those pleasant. All you have to do is just sit with it. Physiological response of emotion is 90 seconds only.
Okay.
Unless you hold on to it with your thoughts and ruminating. And humans are only creatures that are able to hold on to emotion for decades.
Interesting.
Very interesting. But what we do in therapy is just finding those unresolved things and allowing people to process that, to let go of that. Because once you process the emotion, once you understand what it wants to say, it just dissipates. It has no purpose anymore. So I just want to encourage people, just sit in that boredom, sit in that anxiety. Sometimes it's hard and it requires support. But, if you don't wait too long, then you can do it yourself. It's not hard. It's not pleasant, but it's not difficult.
As a therapist, you're helping people with this, and
Yes.
other therapists in Japan are doing the same, and the children, the young generation, are able to take advantage of this, and yet it seems like things are getting worse. You mentioned the smartphone. What is a solution? Because the smartphone is being used more and more, there's more and more apps, everything is becoming more digital. Is this going to continually degrade? Are we going to need more and more therapists to
Probably.
counterbalance, or is there a way to find a...
Oh, I wish I have answer to that. I would get a Nobel Prize probably if I would have an answer to that. Interesting thing happened, in China, that they, I don't know when, a few years ago, they have a law to control gaming time for children.
I remember
You've heard of
in
that?
news, yes.
I don't know how it works in practice, really, but I think that is a brilliant idea because you see, parents are struggling. Parents cannot control their children all the time. But if there is some decision like that happens on the level of country, some institution that can support, then it's so much easier to put it in practice. Because if you rely on on free will, on strength of your mind, that does not exist
already too busy,
anymore.
right?
It's that because in general, minds cannot be strong for a very long time. Willpower gets exhausted. You have willpower probably in the morning, the highest, and then it dissipates.
You wake up and you feel like you can do it, and then by lunchtime it's like,
Exactly.
I just want to go back to...
That's how it works. So for that, we need systems in place to keep us on track. And if we don't have any systems, we are on our own. And, being an individual, it's very hard. Because if you are not always in some super supportive environment, and if we are all alone, behaving differently, thinking this is my free will, I want to do whatever I want, you then just get lost without some, people need structure. People need social accountability to function, progressively, let's say, to be productive, to keep their health, to keep their interest, to keep their optimism. Yeah.
You've got a long career here already, and I've accomplished many, many things. Looking ahead, what are some of the things you want to work on or you want to try to establish here in Japan?
I don't have some big decisions about that, but I think I'd like to get involved more with the community. So, because I'm mainly doing one-to-one sessions, so to involve more in community, maybe to give some, that's not always easy, but like group sessions, or like not public talks, but maybe go to school and go to some gatherings and have just more presence in the community where I live. Yeah.
Provide more people with information that it's okay and helpful to talk about your problems, your unresolved, unprocessed emotions.
Yes. If we could do some like massive emotional release, that would be amazing thing.
Mira, thank you so much for coming to talk to us today.
Thank you for inviting me.
We talked about many topics. It was super interesting. Do you feel like there's something we haven't talked about that you may have wanted to share today, or did we get a good picture of?
I think we covered quite a lot. So
if people have more questions, we'll make sure to have links in the description to your website where people can reach out for advice, or maybe if someone needs some help, you're there.
Or just if they need some research or something. Not everybody necessarily have to work with me. Obviously, there are other resources or there are some guidelines I can provide. So yeah.
Mira, thank you very much.
Thank you.
Thank you everyone for listening and watching this episode. This was Unpacking Japan, and we'll be back again next week. Bye. Thank you so much for joining us today. I hope you enjoyed this episode as much as I did. Please hit the subscribe button so you don't miss out on future conversations. And we'd love to hear from you. Share your thoughts in the comment section down below. And if you enjoyed this episode, here are a couple more that we think you'll enjoy. Thanks again for your support, and we'll see you next time.